So the next presentation has to do with ARPA, the American Rescue Plan. No, just next presentation. It's not this one. That's that American Rescue Plan. Yep. So we're going to go through these slides rather quickly because we want to kind of get towards the slides at the end so that give you more time to discuss the topics and the policy areas. But generally speaking, next slide, the American Rescue Plan it covers costs between now and December 31st of 2024. And then we can incur the cost until then, and then we can actually spend all the funds another 2 years. So it reaches all the way to 5 years into the future. And the allowable expenditures are these 4 categories: mitigating COVID, premium pay, revenue loss, which can be spent on government services, and then infrastructure. Those are the places you can spend the funds. And due to our size, our population, the Treasury allocated the Wyandotte County $87.4 million in revenue. We received half that revenue in May, and we would receive the other half in the middle of May next year. All right, so the next slide. So just want to talk real briefly about some of these allowable expenditures. So in the first category, containing and mitigating COVID, we can spend it on the public health response, medical and behavioral health care needs, and mitigating disparities. And at this point now, I'm going to have Wesley come up here and talk a little bit about this section.
Thank you, Kathleen. So the health department's been working for about a month to look into the future at our COVID response and recovery from 2022 to 2024, and looking at the American Rescue Plan and the eligible uses under it and kind of compare them. And, one reason we wanted to put all this up here is the mitigating COVID use. That's the first eligible use under that plan. There's a lot of different eligible uses under that. And so I just wanted to give you a flavor of the type of requests that we're looking at and the needs in that time frame. So Kathleen laid out the 3 big buckets under this first section. COVID-19 response, those are the elements that we've been coming to present to you about for the last year and change, kind of the core elements of fighting the virus and recovering from it. So vaccines, testing, contact tracing. We need to continue to communicate to the public, and you can see also those items, which I don't think will be a big surprise to you. I'll point out that in the slide before, they mentioned mitigating disparities. A big component of the American Rescue Plan that they put in the plan is they don't want COVID to increase the health disparities that are already existing in communities. So a lot of the emphasis is on, hey, there are already disparities based on income, based on race and ethnicity. So where at all possible, try to use the funds to stabilize those, to make sure that the pandemic, which we know hit different communities differently, doesn't widen those disparities. And so you can see a couple of those items here: supports for vulnerable populations, use of health workers, and then we have a couple items in there about mobile clinics and telehealth programs. And then these are items that are specifically mentioned in the Act. A lot of you are also aware of the increase in urban violence that has happened across the country during the pandemic. And so they put in an emphasis in the plan on evidence-based violence prevention programs, as well as overdose and substance use prevention. And I'll also mention I was pleased a lot of the plan that they have the use of the funds that they suggest in the plan to help to mitigate those disparities lays over really well on our CHIP, which I thought was a validation that we were looking in the right direction. And we do look at the CHIP as a way to push those strategies through and intend to include those in our request. So if you could go to the next one here. This is the next section. Most of the health department's request will be focused on the first section, but this is also in that first use area of mitigating COVID. And you see there is emphasis on making sure those health disparities don't widen, impact on households, tourism, and small business. You can go to the next slide here. And a couple of items that we've been discussing here to make sure that that does not happen. Direct food assistance to the community. You know, we've talked about a lot of people losing their jobs, moving housing situations. There's a big need for legal assistance for low-income residents, which was emerged as a big need. And then Wyandotte's workforce, several needs that we identified: job training for unemployed and underemployed residents, investments in affordable childcare, and a workforce study to assess the needs of our workforce over the next 5 or 10 years. And then a big emphasis on housing, bilingual housing navigators, community land trust as one tool in the toolbox to maintain long-term affordability in some neighborhoods, and then supportive housing. So just a taste, we continue to do planning and figuring out exactly what this is going to look like with Kathleen and others. So I appreciate the time.
So the next slide. So in the ARPA, they also discuss what they call hardest hit communities or counties. It's part of the census blocks that, and the hardest hit census blocks are actually those that qualify for where they want you to really focus on. The census blocks that are considered qualified census tracts are those tracts that have 50% or more of households with income less than 60% of area median gross income. And area median gross income here is $86,000. So 60% of that is only $52,000. So what they're saying is that in that census tract, the people that live in that census tract, 60% of them are to be living you know, under that income level, or a poverty rate of at least 25%, meaning that 25%, then the poverty rate line is defined as $26,000 per year for a family of 4. So of all these blue charts, 89,000 people live in these blue census tracts, and which represents 54% of our county's population. And 22% of those people have incomes below the poverty line. Median household incomes in these blue tracts range from $11,000 a year in block 418, which you can look on your chart, to $45,000 down in the KU Med area. So, and it should note that like the census tract 411, where there's 66% of the 1,500 people that live in that tract live below the poverty line and have a median household income of only $13,000. So there are real needs in our community, and you know, this is a great opportunity that the federal government has given us to address those needs. Go ahead. I'm gonna one more slide. So
we have some questions first. Commissioner Markley.
I raised my hand on behalf of Commissioner Townsend.
Good to have friends in high places. Thank you. I think the point had been made earlier in this presentation that we had until 2024 to spend the money, to obligate the money. Is there a provision for us if we wanted to or needed to go back and offset other costs or expenditures COVID related? Can we do that with this money, or would these expenses have to be after the allocation of the money from the federal government in this plan?
Certain expenses are allowable up to the time that the emergency was declared, just certain, but not, everything. So yes.
Do we have
The
any
answer is
idea
yes.
what those are, what types that?
Yeah, but I don't remember offhand. Sorry.
Thank you.
Commissioner Bynum.
Two questions. When we say hardest hit,
Yeah.
what are the data points being considered? Is it case rate and unemployment? What are the data sets being used to determine a census tract is hardest hit? That's question one.
Okay.
Question two is, I heard you say that apparently the federal government guidelines are saying that a median household income for this area is $86,000.
Yeah, it's actually the area medium gross income, which is the entire area.
The whole metro.
Yes.
Okay, because that's never been true in Wyandotte County.
Yeah, the whole area. And that's what is in the definition for the legislation.
Okay, thank you.
So it's actually saying 60% of that median gross income.
Correct.
Which is 52,000.
And then if you can help us know what they measured to determine a census tract is hardest hit.
So, so the U.S. Census Bureau, right? They have all these tracts, and they have a definition of what a qualified census tract is. And the definition, based on the data they provide us, they tell us which tracts are qualified. But the criteria is in that slide, which states it's 50% or more of the households with income less than $52,000, or a poverty rate, where the poverty rate of the entire tract is greater than 25. So 25% of the people that live in that tract are below the poverty line. So if you either hit one of those or the other, then you're a qualified census tract. And I did want to point out, there are 38 of these qualified census tracts, and 25% of them meet both of those guidelines.
So it's all based on household income. It's got nothing to do with being hit hard by COVID.
No, it doesn't. No, because the Census Bureau doesn't have, their data really lags a lot. So it's strictly what occurred based on the data from the American Survey last year, which doesn't include COVID. So,
Commissioner Burrows.
Thank you. And Kathleen, you and I had this discussion over the weekend in reference to, you mentioned KU being part of that census tract.
Yeah.
That's one of the wealthiest, it generates a tremendous amount of revenue for our community. So when I saw that census tract, I did ask how it was that it qualified as an underperforming census tract when we have a lot of high paying jobs that do live in that area. And so I'm just curious how that might skew those numbers, and if it really is needed to be in that census tract, if it's one that we may want to look at, and we're not being mandated to give a certain amount of money to those census tracts.
No.
All we're doing is identifying those census tracts if we want to invest in those through some of the proposals that were presented. I believe that is the correct analogy.
So I did look at those census tracts in the KU Med area, and there are a few, but the one 452 in the KU area, their average income level is $45,000 a year, but 22% of the 4,000 people that live there live below the poverty line. So that's why it qualifies.
Commissioner Ramirez.
Thank you, Mr. Mayor. And thank you, Kathleen. Just a comment. Looking at the map, it shows that we as a governing body and administration should be diligent in how we spend this. These are investments that we should make sure that are fair and spread out between these census tracts, not just the east, but throughout Wyandotte County. But it shows that we have a lot of disparity. And I just want to make sure that when we go through these processes, that we're diligent and keeping in mind that we are fair in investing and how we spend this money. Thank you.
So, yeah, so we do have a lot to go through. So the one of the categories is revenue loss. And I told you that the Treasury guideline gives us a formula for calculating how much that is. And so I've done that based on my estimates for 2021. And, the guidelines actually say you can claim revenue loss for 4 years, but I'm just assuming we're going to claim revenue loss for 2020 and 21 for now. And given that those 2 years, it equates to roughly $30 million that is available. And so the reason that's important is because that amount has great flexibility. Basically, you can spend those funds on government services. And so providing services to aid citizens, maintenance of our facilities and roads, cybersecurity, healthcare, public safety. So all of those, it's wide open. The next slide. So I just want to quickly go over there. Here on the top are the 4 categories for where you can spend. And we thought we would provide you an overview of our 7 strategic goals, or your strategic goals, and see how those 4 categories align with the goals. And you can see that all of the goals are met with the mitigate COVID and with revenue loss, most of them with infrastructure. Not so much, just a few for premium pay. On the next slide, there's this slide I'm going to pass on to Melissa Stevens, who's going to talk about that.
I'll make this quick. This is Melissa Sieben, Assistant County Administrator. One of the things that we're looking at and we'll love to discuss with you over the coming months is sort of how we leverage what we're already doing with these dollars to make an impact in these affected census tracts. As an example, WIFIA is a program that we've been discussing with you. And that really is going to attack infrastructure work in areas that were historically redlined within our community, which if you start looking at these census tracts versus the redline census tracts, I'm pretty sure they align very closely. What we're hoping to do is work with you to make these investments, then kind of layer to improve quality of life in our neighborhoods, introduce infrastructure that gives people the sense that this is a place to be, and overall improves our public image and attracts new residents as well. So that's all I had on that one, and back to Kathleen.
All right, so the next bubble here, this is a series of bubbles of possible expenditures that meet all of the criteria we just laid out. And so these are proposals that we're examining right now. And at this point, I would like to pass this off to Doug to kind of ask all of you to examine and provide your feedback on what you think is a priority.
As Kathleen said, I think this really kind of brings it as we're looking forward, and when we went through and had some preliminary meetings with commissioners and on threes to talk about where we were from how the American Rescue Plan comes into play. You know, the different ideas, different things that could come in to be eligible expenses, you know, infrastructure being one of the top priority for us. It is not a direct thing, but there are different ways you can approach that by coming in. Buildings fall into that category. And then there's the revenue loss category of where you redirect some of that money and come to it. But there are various areas that we see. So that's what you all should be thinking about. And there's more than this. I mean, you can spin it in almost categories are wide to come to. These are just ones that we've heard mentioned as we went through things, or we could put a pin in into and to say, okay, we know we have a definite need in this area to start to throw some stuff on the board. Is that the last slide, Kathleen? Oh yeah. And then the evaluation process and timeline moving through this. As we look ahead to our budget process, which we're just looking to do the American Rescue Plan and just mirroring our budget process as we go through and identify where we see the priorities of where we want to spend that money designated as we come into it. So we're next budget workshops on the 15th, and then we move forward into August and then for a September adoption timeframe. And Mayor, that's all we have on this part.
Commissioner Markley.
Okay.
Thanks, Mayor. I think I said in a prior meeting, and I'll say it again, I think it's really important for us to think about the long-term benefits of anything that we're doing with this money. Like, it's great to get money and you can go out and buy a new shirt or something like that, and that's lovely. but we need to be thinking about what does what we spend the money on get us in the long term. And so a couple of things that stand out to me are we've been struggling to reach a stormwater rate structure that everybody is comfortable with. So spending some money on stormwater infrastructure so that we can lower the amount that we have to charge our residents as we increase those rates would be lovely. And I think that gives us a great long-term benefit. And then I've hammered on it before. I think we have some facilities we could stand to close. I understand that in order to do that, we need to make space in our existing facilities that we want to keep to accommodate those employees we're going to bring from the facilities we'd like to close. And in order to do that, we're going to need some money to remodel the facilities we want to keep. And I think that's a great long-term benefit as well. I would say if we spend that money to retool these buildings so we can keep them, we move employees out of other facilities and close them, every dime that we save from closing those buildings, we should put into infrastructure, and that's how we should use that savings. So those are my thoughts.
Commissioner McKiernan.
Thank you. I thought actually Commissioner Bynum was ahead of me, but that's okay. I'll just say ditto everything Commissioner Markley just said. I agree 100%. And then I just have a question on the timeline slide, which is the next one after this. It says, it appears to say, develop criteria and prioritize for today. And I don't know what the process is for developing criteria and prioritizing if that's something we want to accomplish today.
I think it would, I mean, it's important to get the feedback of what you just said. You know, if that's priorities you want to have in, or there's additional things coming in. I mean, that's where we're at today of making sure we're getting to it. I don't think building that slide was necessarily meaning definitive July 1st, but this is the stage of the process we're in. If you have ideas, thoughts of how you want to put in for priorities, if you want to submit those to us as staff, bring them up today, however they come about. But this is a time when we start coming up with what our priorities are and if these fit into them or if there are other areas.
And I guess I would just say that I'm a little unclear on what our timeline is for actually establishing the prioritization and gaining all the criteria. I mean, the slide does say today, so how are we going to lay this out? Because it says on July 15th that we'll assess feasibility, viability, and timing. So it's a pretty aggressive timetable. And I just want to know, what are our markers?
Yeah. So
goal attainment along the way.
Yes. So our thought is that we want to get feedback from you individually or in the public setting here about what you feel is the highest priority. And so either between now, right now, or through July 15th, you can give us that. And then as we're compiling the list of projects, we're going to come back on July 15th, provide you that list, and also share with the group what the feedback we got from all of you were. And then, we'll develop that criteria and the prioritization at that time. So just keep in mind that because of the size of the dollars, 87 million, we, and the pockets of dollars that, that meet the provisions of the 4 provisions, it's a little tricky, but it's not, it's not like yes on this and no on that. It's actually more nuanced to that. It's, how much of this as opposed to that and where. So it's going to be a process, and this is just the first phase, so that you have an idea of what we're looking at. You're going to get a lot more data and more information on July 15th.
I guess I'm still not perfectly clear on what our process is moving forward. Do you want a free-form list of priorities? Do you want a rank-ordered list of priorities? Do you want it based on these bubbles that are on this slide?
Yes.
Do you want us to just make something up? So I think I want to find a little bit more guideline. Do you want us to suggest prioritization to you?
Mm-hmm.
So you want us to use these bubbles?
Yes.
And prioritize them? Not, okay, that's good to know.
Yep.
Commissioner Bynum.
I think my questions are similar. So I'll put in a plug for infrastructure / stormwater right off the get-go. But I also think that we've got to utilize some of these funds for some of these more human needs, if you will. So we have agencies in our community who've been working for decades and working double and triple overtime for 14 months on issues like homelessness and health disparities and mental health issues and housing. And I thought I heard in the last week or so that there is a separate allocation coming from somewhere apart from American Rescue Plan, or else going to either the state or CDBG or something for those kinds of issues. I need to understand better than I do right now where all the buckets of money are.
And that is a perfect question. So I do want to explain. So the entire ARPA is almost $2 trillion. And there's a section in it that is allocated to the state, or where locals can actually apply for grants directly. That is not what we're talking about here.
Okay.
This is the 87 million we're getting directly. I did want to add to Commissioner McKiernan's question, because we are, Doug and I are also wanting to get feedback from you on, how you would like to see the process too. So we're not telling you how we want it. We want to get some feedback on how you would best like to discuss the scenarios. So, and the prioritization.
Just to kind of round out what I need help with. If we knew so here's my point. This time and funding feels like a once in a lifetime opportunity to completely eradicate homelessness in Wyandotte County. And I would hate if we missed that opportunity. If there are funding opportunities that are elsewhere outside of the 87, I need to know that. It changes my prioritization, because I'm going to hold firm to my belief that infrastructure is sitting at the top of the pile, but there are smaller amounts of money that can go a super long way on fixing some of what hurts. So we know, and Melissa, that there are agencies here in the county who believe they have plans that can eliminate homelessness. That would be amazing. So is there a way for us to see a chart, something, a graph, a rubber chicken graph with all of the potential places where money is going to flow into the community? So that's one question. And the other one is, Doug, I think I'm seeing, if I'm reading this timeline right, County Administrator budget presentation, August 19. Is that the one that we would have usually seen by now?
Yes.
Okay, so that's pushed out about 2 months.
Yeah, that's the one you would have typically saw either like today.
Got it. Okay, that helps a lot. Okay, I'll stop. Thank you.
Quickly, Commissioner Bynum, we have HUD dollars that we will be targeting towards homelessness. Very specifically, that's what those federal dollars have come down for. It's $3+ million that we have in our hands to spend. Those were some CARES allotments from last year that we haven't spent, and other dollars that have come in subsequently this spring. Separate conversation there, but we will be coming back to you with information related to that. And we have been talking to those groups, as you are aware of. You've seen me on 2 different conference calls, and we've had several others. We're at no means at a point to bring forward how to do that. Those dollars have a much longer time for expenditure. Obviously, we want to get them into the community as quickly as possible to address the concerns that we are all dealing with in different ways throughout the county. So just know those are a separate pot of dollars totaling a little over $3 million, maybe slightly north of that. Okay. Mm-hmm.
Commissioner Burrows.
Thank you, Mayor. Well, and I appreciate the advocacy of my fellow commissioners. The prudent thing to do is ensure that we get the best return on investment, whether it be on the human side or whether it be on the infrastructure side. But one thing we shouldn't forget is those that were put at the point of contact dealing with COVID. And that was our public safety personnel. Many of them were put into a hazardous environment while COVID was active in our community, and are still where they were mandated to work. They worked long hours. I would like to see some of this CARES dollars earmarked for a bonus for our public safety employees, police, sheriffs, jail workers, frontline healthcare workers that we can identify through payroll. And I would suggest that we don't pay them by hours worked or by pay scale. I'll borrow Commissioner Kane's comment that when we provide the bonus be on an even amount, hypothetically $1,000 per employee, as a recognition of their duty to work during the most dangerous time our community has seen in modern times. I don't think the amount is that onerous. I believe it would be a show of goodwill, and we could do 1,000 this year and 1,000 next year when the second allocation comes out, because if it was stated by Commissioner Johnson, I don't think we're out of this just yet. And goodwill goes a long way during a crisis. And I truly believe that those dollars would be well spent to send a message to those that were on the front lines that we value your work or respect what you've done. And more than anything, we want to partner with you to ensure that you know how we feel that you put yourself on the front line for us. So that's one. The number of bubbles that were up there were bubbles that were thought of by the staff and going through the sheet. So I would like an opportunity for us to have a chance to look at some additional bubbles that may go in there. And one thing I didn't see in there was holding those dollars for a year or so and drawing the interest off of them, and maybe meet some of the human resource issues that were brought up in reference to our community. But I am aware that the federal government and the state will be giving money to small businesses, and those that have already received money those loans were forgiven. So it's one thing, we are not in the business of funding businesses. We are a government that is for the people here in Wyandotte County, and our responsibility is to ensure that we provide our services in a responsive and a responsible manner. And I would hope that as we go through this, we all have sacred cows and we all have things that we want to see, but broadband expansion in some of our most underserved areas in our community is extremely important, especially moving with a hybrid system that we have in business and in education. I think that's extremely important. And as we move through this infrastructure, I think there's ways to capitalize on infrastructure. We can use some of those dollars up front, but we can also bond them and set that money aside, draw interest on that money, and have it earmarked for infrastructure investment as we move forward. So it's about prioritization, but I would hope that we give strong consideration to those that have put themselves out there in the last year and a half, serving this community in an unselfish manner, protecting our health, but send them the signal that we do value you. So I will be advocating extensively for an additional funding for our public safety workers.
Commissioner Ramirez.
Thank you, Mr. Mayor. My priorities line up with both Commissioner Bynum and Commissioner Burrows. Infrastructure, we know we've been painted the dire picture of our infrastructure. That's important. And the human needs, mitigating the disparities in our community. We can have improved infrastructure, improved amenities, but if we don't have happy, healthy residents, then what's the point in investing in our infrastructure and our amenities for them? And so I think that's important. And also the public safety personnel, Commissioner Burrows is completely correct. They went above and beyond their job of what they were normally supposed to do. I always talk about our public health department. Unfortunately, on a normal, quote, normal year, normal non-COVID, most people don't hear about the public health department or know what it does. But last year, our health department was front and center of everything. And they did like I said, above and beyond their job. All our staff here at the Unified Government did. And so I think we need to remember personnel, our infrastructure, and most importantly, mitigating those disparities that we have so that we have happy, healthy residents to enjoy the amenities and the infrastructure that we improve. Thank you.
Commissioner Philbrook.
Just give me about 300 million and I can get some of that spent in a heartbeat. I agree with most everybody here. There isn't anything that we've mentioned that's not important. That always makes it the hard part. Where do you spend it and where don't you spend it? Who do you not spend it on, or what don't you spend it on? Number one, of course, again, just like several other people have said, it's infrastructure, because if we don't keep the infrastructure in place and halfway decent, it's dangerous. It's dangerous for them to drive on the streets. It's dangerous for them in their houses. We got sinkholes, all kinds of things going on. It's just not a pretty picture. And so we have to catch up on that. And that's going to be a major task. The other thing is the human needs. And that's a big, broad swatch of area. For me, when I talk about human needs, I'm talking about the housing, the wraparound services that go with that. And that means all of the stuff that affects your life. That could mean mental health issues. That could mean abuse or violence, all of those things that come along with poverty and being in situations where you can't get out. And that's tough. So along with that, then of course, are the jobs and education, so you can work your way out. So all of that's the human condition. What I want to know is kind of like several other people want to know is, we have possibilities of buckets of money coming in to different entities that can ask for it from the federal and the state folks. But how do we know? How do we know which one of those folks are getting the big buckets of money? Unless they share that information with us. And we already know of one or two that have already gotten some funding. But the whole point is that how do we know where we need to put our the UG dollars, the tax dollars that we have been given to be, it's our job is to spend the money wisely, as Harold reminds us constantly. Thank you, Harold. It's tough. It's very tough. And yes, I'm whining a little bit because I don't know how and where to put this money at this point without having a better idea of what some sources are going to be for some of these other areas that we're prioritizing. So I'm open for a lot of suggestions on that. I'm sure that we can ask our community partners that are helping deal with some of these other things, if they've been given funds or if they're looking forward to getting funds, so we can use the money that we have to expend in a more expedient and effective way. And the other thing is maybe we can have them help us, and we can use that money to leverage and be more successful as working as a Wyandotte County team versus just us trying to fix everything. That's where I am.
Thank you. I'm going to echo a lot what Commissioner Markley and others have said, but I think we have an opportunity to really bend the curve on some of our long-standing needs for capital improvements, streets, bridges, stormwater, and the redevelopment of builder-ready blocks. Again, we will have a continuous hole in our tax base until we redevelop those parcels in our community that have been hollowed out for decades, that still require the infrastructure, still require police and fire, still require all the services we provide, but generate no income. And we have an opportunity with the right kind of strategic investments in those areas to bring those back into production, generating revenues and bringing new population, new people living here, that will be a long-term support to help us solve the other problems that we see faced here. We have to be strategic and focused and intentional that we want to change the trajectory, long-term investment in our community. So the last comment we have on that.
Right.
Mr. Bach? Yep.
Thank you, Mayor. That does conclude the presentation. We appreciate all the feedback. This will be an ongoing process as we work toward building a budget for presentation in the middle of August, as we continue to target and figure this out.